I think that there are a couple of things that are really important in terms of when you're a site visitor going out to a birth center. One of the things that's really important is just remembering how stressful and anxiety producing the whole experience is. It's difficult as a birth center owner, director, provider to have people come in and investigate everything about what you're doing. And I speak from experience when I say that. It's very stressful and very, very hard. And birth center people always want to be perfect and doing a good job. So it's important as a site visitor to understand that and appreciate that and do everything possible to sort of mitigate that anxiety and make it a less stressful experience to the extent possible. I think it's also important to remember that as a site visitor, you are an advocate both for the commission, for the accreditation of birth centers, but also an advocate for the birth center. So you're there to represent the commission to the birth center, and you're there to represent the birth center to the commission, and to represent both of them in the very most favorable light that you can. That means that it's not a punitive, let's see what we can catch sort of role when you're there. You're there to help the birth center explain what they're doing and explain it clearly and completely, and the rationale for what they're doing in some cases, so that they can be represented in the very best light to the people who are making, the commissioners who are making decisions about their accreditation. The other part that is really important as a site visitor, I think, is that you know that it's an educational process. You're there certainly to evaluate whether the birth center is in compliance with the standards, and that's of course critical, but you're also there to help the birth center become excellent in every way they possibly can. And so you're there to educate them, you're there to help them, not to teach them the way it's done in your birth center, because that's not your role. But you're there to give them other ideas about how they might do things, to help them learn, in some cases, why a certain standard is important and what the intent of the standard is, and that it's not simply a form to be filled out or a checklist to be checked off, but that it has meaning and intent in terms of the quality and the excellence of the program of care at the birth center. I think it's important to be very detail-oriented as a site visitor, which can be uncomfortable because you're sort of, it's like going into someone else's house and opening all the cabinets and closets, which none of us are very prone to do. So it's important to know that you need to do that, and that you're looking into all the paperwork and all the contracts and all the charts, and looking at very minute details about what's going on. That's a very important role of the site visitor, because you are sort of the eyes and the ears of the commission when you're there also, and the commissioners who are making decisions about the site, about whether a site should be accredited, have to sort of feel as if they were there. And that's what the site visitor has, that's the level of detail the site visitor has to provide to them so that they can make good decisions. Site visitors have to be up to date about the standards, certainly the AABC standards, the CABC indicators. Those indicators change often, and site visitors need to be aware of those. They also need to be up to date with just general and other national standards and guidelines that are relevant to birth center clinical practice. So the CDC guidelines, for example, and OSHA regulations, those kinds of things. And those also change fairly often, and so site visitors need to keep up with those and know that they are current in all of those areas. The education role is really important. The idea that you are there to help the birth center become accredited, to help the birth center be excellent, so that they can do the very best that they possibly can for their families, which is what they all want to do. So you're there to help them do that, and educating them in whatever way is needed, whether it be here's an idea for how you might revise this chart form, so that you're documenting a particular nutritional assessment better. Here's a way you might want to think about organizing your emergency supplies so that they're more readily accessible to you. Those are things that, as a site visitor, you can give them information about. Again, not telling them how you do it at your center particularly, but from seeing other centers, what has worked and what you have seen worked in other centers. That's part of what makes the site visit valuable for the birth centers, I think.